Definition of high cholesterol keeps changing. In 2004, a US panel of experts decided to lower the threshold of cholesterol, which sparked outrage among many doctors.
More and more people think they have high cholesterol, even though they don't have high cholesterol.
By changing the definition, it meant that millions more people became eligible for statins, and these thresholds were adopted by many countries around the world.
Has this been on the basis of any scientific data? Absolutely not. Absolutely not. No evidence whatsoever. Just the theory that less is better. You're creating more patients. You're creating more people who now have something to worry about where they didn't have anything before.
But Dr. Sullivan insists this was a good decision.
I think what we actually started off with was maybe appropriately conservative targets, which were really not in the patient's best interest. So the likely outcome is a further reduction in targets.
More cholesterol lowering?
Yep, I think that's absolutely to be expected.
The decision to lower the threshold of cholesterol was a controversial one. An investigation into the matter revealed 8 out of 9 panel members had a direct conflict of interest after declaring financial ties to the companies that manufactured statins.
We don't have independent reviewers evaluating the data and making independent recommendations. You might ask, am I accusing these people of selling their opinion because they're getting paid by the drug companies? No, I'm not. I'm not accusing anybody of bad faith. But the people the drug companies choose to pay are people who advocate the use of their drugs and have standing and presence and reputation that will enhance the sales of their drugs.
So do drug companies seek out doctors to be their mouthpieces?
Drug companies clearly seek out what's called key opinion leaders. These are people with a national reputation who can create the street knowledge for practicing physicians that this is the way things should be done.
There is ample published literature showing that doctors who receive money from drug companies have more favourable attitudes and prescribing habits towards that drug.
There's no question that doctors are influenced by drug companies. I hate to say it, but drug reps showing up in nice suits and fancy women's clothes without much medical education play a significant role in what doctors think. Now, there's no reason for doctors to be getting their information from drug reps. My goodness. The drug rep's job is to increase the sales of the drugs they represent. Doctors need to take some responsibility. They need to do their best to get independent knowledge, and they need to put political pressure on their governments to get the clinical trial data unsealed so they can know what the clinical trials really showed.
Many doctors feel obliged to follow the guidelines, even if they don't agree with them.
They have to worry about malpractice suits if they don't follow the guidelines. An opposing attorney could make them look very bad in court by saying, well, doctor, do you think you're smarter than this national group of recognized experts? And this is a factor that's impelling doctors to follow the guidelines.
The push to lower cholesterol in the wider population continues. A group of doctors published an article claiming that statins could counter the effects of eating a burger. They suggested that statins be handed out as free condiments, just like ketchup.
Because it gives people that false reassurance that it's okay if you eat this food that is not good for your health, because then you're going to take this pill.
And the absurdity doesn't stop there. Here in the US, it was even suggested that statins be put in the public water supply.